So thank you very much, Bruce, for that. That's really excellent, and I really is going to stimulate, I hope, a lot of discussion. We've got about 25 minutes now where we're going to talk about the role of PrEP in stigma. In addition, you can ask questions about any of the presentations or anything else you really want to ask about. And it's a great pleasure. I'm joined now by the two Bruces who you've already met, but also by Alessandra Ramos from Brazil, welcome, and also Alícia Krüger, who you met in the last session. I'm actually going to do something very bad because we're running a COVID vaccine study here and it's running a bit late. So if I disappear from shot, it's because I've had to go and see a patient briefly, and Bruce Agins has very kindly agreed to carry on if I happen to be absent. So I'd like to start, PrEP has, as you saw in Mauro's slides, has really revolutionized HIV and led to dramatic reductions in new diagnoses, along, of course, with other tools such as increased testing and successful therapy. But when it comes to PrEP, I'd like to ask all of you, is PrEP actually destigmatizing HIV, or is it stigmatizing individuals who access it? People being called such things, horrible things such as Truvada whores and things like that. And, so the first question I'd like to ask, and perhaps you could talk about the areas which you're involved in, is has PrEP led to destigmatization or increased stigmatization? Alessandra, do you want to start being new to the panels?
Hello, everyone. I'll try to do my best speaking English. Well, I think that overall PrEP is a very good strategy to address coping with HIV stigmatization for LGBT and other key populations that are involved in PrEP. I think that, yeah, we have all this reaction from society, but we can establish a parallel when, for example, the anti-contraceptive pills started as a strategy in the public health. We can say that many of those things repeated there and now are repeating with PrEP. But I think at the long run, the benefits for the population, for the key populations, are really good and promising. And also in the augmentation of self-awareness and self-care, since you're getting from your providers PrEP constantly, you're also more linked to knowing more about your own health and being more receptive to healthcare in general and sexual health in general. But one of the things that we really have to connect the dot here with the stigma is also it's also about in relation to the trust that the key populations have in relation to that technology, to that strategy as something that will be efficient for them. We really have a long path to bridge that gap that is really a problem in prevention and for those hard to reach populations, especially when class come to play, money and being Black and being trans and all of those things.
Bruce, let's go. Bruce Richmond, you said it was going to be interesting. So Bruce, what's your view on this?
Well, I think PrEP is an incredibly powerful and an essential tool, a prevention tool, and it's an essential piece of ending the epidemic. And it's sort of the PrEP and U equals U are two sides of the same coin in terms of prevention. In terms of stigma reduction, you can't even compare PrEP users who get stigmatized for using PrEP and people with HIV who get stigmatized and have been living and dying with stigma for decades. And too often we see them compared in that sense. But I think in terms of PrEP reducing, it certainly reduces the fear of contracting HIV, but in terms of reducing stigma towards people with HIV, I'm not so sure. Because what we're seeing, and I think people who are watching this may agree and see this as well, is that on the sort of the dating apps or the sex apps, you'll see PrEP, neg on PrEP is sort of the top stratosphere. And you'll see neg on PrEP guys or people, folks, going after to find other neg on PrEP. And someone who is HIV positive, undetectable or detectable is still sort of feared and sort of the lower rung. And I think that it's going to take a lot of time for those deep-seated fears of people with HIV to go away, regardless of whether someone is using PrEP or not. I mean, there's a major activist in the United States who is promoting PrEP for a long time, and a dear friend of mine who said he got into the field of started working with PrEP because he was so afraid of HIV and people with HIV. And he really dealt with his own serophobia over a period of time, and will have sex with people with HIV, but still sees them, deep down as somehow less than, or irresponsible, or having the disease that he is trying to prevent from getting, but he will have sex with them. So that's he's come a long way. So bottom line is, I'm cautiously optimistic that eventually over time, with folks using PrEP and being less afraid of HIV and learning about U equals U, and learning that anyone, regardless of your viral load, is not dangerous, we'll start to chip away at that kind of stigma.
Bruce, can I just push you on something you said? But, increasingly being recognized is self-stigmatization. So do you think PrEP, my thoughts is that it must be at least some help in that, taking away the feeling of, I might infect someone.
You mean a person like myself who's living with HIV, do I feel less stigma because there's PrEP in the world? Or I'm not sure the question. I have to say, okay, so I don't want to date anyone who needs to have PrEP to be with me, because that means they're still afraid. And I want to have sex without any fear whatsoever and any anxiety. I'm glad there's PrEP in the world, and I encourage folks to use PrEP if it works for them, especially people who are in power imbalances where they don't have options to choose contraceptives, prevention methods with their partners. But yeah, no, I don't, it doesn't help me with internalized stigma. And in fact, it makes it worse if someone that I'm with has to use PrEP because they're still afraid, they're still anxious. I don't want any anxiety in the bedroom anymore.
Okay. Alícia.
Okay, thank you so much.
Alícia, if you can talk for about 5 minutes while I just go, I'm just disappearing for 5 minutes. Okay.
Bruce or Alícia? I couldn't hear.
I think he was calling on you, but I can make a comment after you, so go ahead. Yeah. Go ahead, Alícia.
My internet connection is really terrible today. Okay, thanks for inviting me for such an important panel like this. And I think PrEP, yes, can reduce the stigma, but it depends on how you think about PrEP in the context of the HIV combination prevention, because PrEP is not only a pill. PrEP is a strategy of sexual health and reproductive health. For example, for transgender people, you can deliver PrEP as a healthcare protocol. You can deliver PrEP. You can conduct PrEP as a healthcare tool, a health and sexual health tool for transgender people, as hormone therapy already is. You can gather hormone therapy and PrEP as two different and combined tools for promote sexual health for transgender people. For example, we don't talk nothing about sexual health concerning transgender people. We talk about surgeries, we talk about hormone therapy, but we do not talk about, for example, having kids. We don't talk about have a safe sex with using PrEP, for example, condoms. I think the stigma that involves PrEP is the same that involves hormones, because we think in PrEP only as a medication, as a pill, and we have to go over this thinking.
Great, thank you very much. Bruce,
Yeah, Mark, I just wanted to make the comment that in some communities where people with HIV are, especially in other continents, where populations may not be as open about HIV, and there is a lot of stigma in the community. There's also the factor of people going on PrEP and being afraid of being identified as having HIV because they're going to a place where they get their antiretrovirals or they're seen as somehow taking antiretrovirals. And it's something to consider for some people in terms of where PrEP is dispensed and delivered, and to consider. And again, it's going to be very population and community dependent, and argues, I think, for a really sensitive cultural understanding of the implementation of PrEP services.
great. So when we talk about people accessing PrEP or not accessing PrEP, what are the barriers that stop them, and how do we overcome the barriers and make it more normalized? Anyone want to comment? No.
Well, public media campaigns obviously go a long way, and having people very visible who are prominent. And living in New York City, I live in a place where you can see information about PrEP on the subway, or the subways, on billboards, and the Chicago campaign, I think that it's had some incredible posters, and I think that really helps to destigmatize and get people more willing to go on PrEP.
And Alessandra, Alícia, but can you comment on, from South America, perhaps particularly in Brazil, how easy it is to access and what the barriers are in South America? Alessandra, sorry, I think I interrupted you.
I will, yeah, do you listen? Are you listening?
I am.
Oh, okay. In terms of Brazil, the service of the offering of PrEP started as of 2018. We're not at that point where PrEP treatment is so visible, and the attempts of making it visible came across as some kind of moral panic attached with PrEP and stuff we all know about, that people raise questions about the using of PrEP. But it's becoming more common, especially among the middle class, high middle class, educated, gay, white population. For other populations, we still have another problem, because even they can understand on a conscious level what PrEP means, I think there is still a trust issue that they have to deal with, especially trans women. They don't go to hospitals. Alícia just said that in the last panel and this panel. They don't go to hospital because they don't trust who's there, and because they know what's going to happen, because they're afraid of even a glance, a stare, of something, and this is really difficult, because because even if you know that what's going on, even if you know what you have to do, you still have to deal with the shame, with the internalized stigma that you have on yourself, and to break that. And I think, for example, the work of peer navigators in the services, this could be really helpful to reach those populations, to be more knowledgeable. More communication strategies with those populations should be also useful.
Yeah, I totally agree. Sorry. I totally agree with Alessandra, and I think when we talk about PrEP concerning transgender people, we don't have to talk about PrEP as an HIV-related care, because it's not an HIV-related care. It's a sexual-related care. And again, I think we need to combine the use of hormones, for example, the hormone therapy-related care, combine it with PrEP, because these two medications, these two strategies are focused on sexual health. And I think, for example, in our outpatient services, we call ambulatories here in Brazil, the transgender services here in Brazil, I defend that this kind of services could prescribe PrEP, could deliver PrEP to patients, not only HIV-related services, because I think it reinforces the stigma to transgender people, because transgender people experience a lot of prejudice, a lot of stigma, not only related to HIV, but related to being marginalized, for example. So I think when the transgender specific healthcare start to offer PrEP, to prescribe PrEP and deliver PrEP for transgender people, I think we could improve this situation. For example, here in Brazil, I don't know if you agree, Alessandra.
I do. I just would like to say this very, very tiny sentence, which is we have to, in order to make PrEP a real, stigma reducing, a real good strategy for all those hard to reach populations, we really have to demolish structural gaps, structural walls that exist before we really do that. We really can. PrEP can be effective, but if we do that first.
Perfect.
Bruce Richman, could I ask you, there's a question that's come up. Why is there stigma and discrimination involved in the use of PrEP?
Oh, and PrEP. Well, I think people think immediately of sex without condoms, and that why are you using, and we're so attached to the condom in this field, for decades. And there's this feeling that people who are using PrEP are going to be, and I don't like the word, but promiscuous. And there's nothing wrong with being promiscuous, and there's nothing wrong with having sex without condoms. But we live in a world and many countries that are sex negative. So there's that judgment, I think, immediately attached to the use of PrEP and linking to being promiscuous, and that's what we've seen, at least in the United States, for sure.
Bruce, I'm just going to stay with you. Sorry.
I was just going to say, and that's a huge issue to face as PrEP is rolled out, because there are a lot of providers that have these attitudes, and it's an area where there needs to be more focus, I think, particularly in primary care places or in thinking about alternative delivery strategies outside of a structured medical environment. Okay. And I think, unlike the UK, we don't do such a great job with sexual health in the United States.
Another question is, I was going to ask this question a slightly different way, but the use of art and artistic media to actually reduce stigma and illustrate the roles of PrEP, of U equals U. And I was going to ask, the role of the media in actually destigmatizing. And I was going to ask Bruce Richman, because certainly, U equals U and PrEP, is widely advertised in the United States, isn't it? It really tries to get to the populations. And do you think that has been successful?
U equals U is widely advertised. PrEP, strike that. PrEP is widely advertised in the US, in places like Vietnam and Zambia and the UK, Italy, other parts of the world, Australia. U equals U is well advertised, but I wouldn't say it's not well advertised in the US. We have a whole staff and team that's working on getting our national leaders and organizations to make it a priority. But PrEP is there's excellent advertising on PrEP. There are still really good programs on U equals U. I don't mean to say there's nothing in the US. A lot public health departments are doing great work, but it is really important. I mean, it's important to continue to put out positive messaging about that. That includes, a message that sex is normal, sex is healthy, and that normalizing the use of PrEP, normalizing U equals U. I would venture to say it's even more important to get the U equals U message out immediately, because of the millions of people, hundreds of thousands in the United States, who do not know they cannot transmit HIV, and their lives are at risk because they and other people think they're infectious. But we have probably 50 times the amount of PrEP information going out to the general public than we do with U equals U. So we need to have both messages getting out there, and we need the media, we need popular culture, we need celebrities, we need mainstream media to get the message out.
Okay, anyone else want to talk about the role of art and media? Okay, so we move on. So what do you think is going to be the effect of, we're soon going to have long-acting formulations for PrEP. Do you think that's going to help in any way, or is going to make things tougher? Alícia, you're nodding, so I'll come to you first.
When it comes to transgender women, mainly in Brazil, we have a specific scenario here in Brazil, because a lot of transgender women and travestis have a lot of silicone injected into their bodies. And how can we inject PrEP into their bodies? We could think about implants, intradermal implants, for example, but I'm not sure, because our reality here in Brazil is very specific. And we don't have healthcare services that can attend these demands.
So let me carry on with that. What about over-the-counter PrEP? The contraception, certainly in the United Kingdom, is now available over-the-counter, the morning after pill. Do you think PrEP should be available, on-demand PrEP in a similar way? Do you think that would be helpful?
In Brazil, I don't think so, because it depends. It depends on the situation. For example, for women, in Brazil, our guidelines say that we need to use daily PrEP because of the cisgender women, the sex workers, cisgender women that can use PrEP as well. And and we don't know nothing about transgender women who have had her surgeries, for example, the surgeries, about the biodisponibility of the drug in their new vaginas, for example. I don't know the answer to this question. I don't know if it could be a reality here in Brazil. It could be for gay and another MSM, but I don't know about transgender women, for example. It could be for sex workers, for example, transgender women who are sex workers, but I'm not sure. I don't
Bruce,
know what Alessandra thinks.
Here in Brazil, we're starting to convey some studies about availability of PrEP and PrEP usage for trans women. And we have to recognize that we've been doing a very bad job all around the world on disaggregating data and observing trans women and trans men as a specific group that needs to be looked differently than MSM. In the majority of research, even though on the name of the research, they say MSM and trans women or MSM and trans people, they would not address the data on that research specifically targeting trans as a different community. And we are very different because we have habits, identities, living conditions that are completely different, and we have to be assessed by the research differently. So I think, no, we're not ready. PrEP on demand is something that's going to be implemented in one of the studies that I participate in the Brazilian Health Foundation, just as a purpose to study how is it going to be implemented on gay men. But for trans women, definitely not, because we don't have enough data, and also because we don't think this can work, specifically given the economic situations of trans women in Brazil. If you consider that a trans woman who is a sex worker don't have their, cannot anticipate when she's going to be approached, this is going to be very difficult to be implemented, and the identity of the spaces between medications and all of those things has to be properly addressed and tackled.
Great, thanks. So there's a couple of questions. I'm going to ask Bruce Agins this question, and I think it could take half an hour to answer, Bruce, and we've got 2 minutes. But the question is really, when you're setting up a PrEP program, do you have to start off by actually educating all the population prior to actually setting it up, or should you just target very at-risk groups and individuals to start off with? So is there a need for education prior to setting up the program for it to be successful?
Well, I mean, the short answer is it depends, right? So, but I think that the key, I mean, clearly, if you are going to target a well-established population that is already familiar with PrEP, and you have a group of providers that are focusing on that population, the amount of work that you have to do to get going is less. then you might have to do otherwise. And just as an example, what we did in New York State several years ago, because we knew this was going to be a major public health strategy, was we set up a demonstration project and specifically involved diverse types of facilities to pilot the use of PrEP. So a couple hospital clinics, federally qualified health centers, community health centers, HIV specific clinics, and a substance use program, and I'm blocking on another. But the idea was to really make this a public health initiative and include a major educational component in it.
Great, thanks. Bruce Richman, a quick answer to this question, but I think it's a great question because you've said that, you know, scientists trust U equals U, doctors trust it, that those individuals living with HIV trust it. There's a question, what about the partners? Is there any research actually asking the partners of people who are infected whether they trust the data?
That's a good point. That's a really good question. Up to now, I haven't seen that. U equals U is still really new, and research on U equals U is still new and up and coming. But if I do come across something like that, I can send it to you, and maybe we can get that out. I haven't seen anything though. Good.
It came in. I thought it was a really great little research. I'm going to beat you to it. I'm starting the questionnaire tomorrow. So we're going to finish them, but I'd like to finish with Alessandra and Alícia. Can you give the audience one take-home message? So start with Alessandra. You're on mute, Alessandra.
To give what? I'm sorry, I didn't understand the question.
A take-home message. What would you ask, you know, a short, sharp thing for the audience to take home? There's
still a lot to do. We have to keep fighting against stigma and discrimination, especially against difficult and hard to reach population, vulnerable populations. We have to take care of ours, especially in our country, in Brazil, where we're facing a lot of problems with hate speeches and difficulties of access and barriers, where the government just launched today an attempt to privatize the health sector, the healthcare sector. We have to be aware of that. So let's keep together in this dividing times and go for and keep working.
Great. Thanks, Alícia.
Thank you so much again. Thanks, Alessandra. I would like to thank all this transgender social movement in Brazil, because if there was no social movement, I was not here today. So there was a lot of struggles, but there is a lot of force. There is a lot of power coming from the people. We are facing a real difficult scenario here in Brazil, but we have a lot of power. I don't want to share the idea of PrEP being a sexual and reproductive health tool and not only a pill, as well as hormone therapy. Hormone therapy is not only a pill, it's not only an injection, it's a healthcare and sexual health too for transgender people. So we need to promote health and not thinking about diseases or not thinking about medicines only. Thank you.
Okay, Bruce and Bruce, very quickly, take home message.
Okay.
No, you'll be much more forceful than me. So let me just get a quick shot in. Is that, you know, I think we have a lot of work to do to understand and have an impact to reduce stigma in the provision of these services. Just like we've been doing with HIV stigma, we need to focus on PrEP stigma and reluctance to promote U equals U in the same way, and link provider information and consumer information to address the issue effectively.
And Bruce?
And great. And I would say when we talk about U equals U, which is, I mean, PrEP, which is so important, we need to also talk about U equals U. It can always be slipped in. And hey, did you know U equals U to whomever you're counseling? And that it must be a revolution that includes everyone. U equals U is just aspirational for many people with HIV. And so we need to make that link between, look, if we want to end the epidemic, we need to invest in the well-being of people living with HIV, because if we make sure that people with HIV have the treatment and the care and the diagnostics that we need to stay healthy, we not only will stay alive, but we'll stop new transmissions and get us closer to ending the epidemic.
Great, that's fantastic. I'd like to really thank you all for that discussion. Alessandra, Alícia, and the two Bruces, thank you very much.